You're watching the Wellness Hour live. I'm Randy Alvarez. Today's topic, stem cells to look younger. It's being used in plastic surgery, minimally invasive, non-invasive treatments. With us, we have an expert on the topic, well-known all over the world, board-certified facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, welcome to the program.
Thanks. It's good to be back, Randy.
Okay, good. Now, for people that don't know you, great credentials, by the way. I guess you head up the facial plastic program there at UCLA, inventor of the endoscopic brow lift. Every plastic surgeon I think that I know and that I've talked to that has been on this show, they know who you are. They've heard one of your lectures or learned some procedure from you. So for people that don't know you, I mean, tell me a little bit about your work at UCLA and also, you know, who's your typical patient these days?
Well, Randy, my work at UCLA is a real privilege. I get to train younger doctors who have already finished their residency and spend an extra year. Most of those go into academics and teach other people. So I really feel like it's a privilege to do that. One of them, in fact, did the first full face transplant in the world. So they're very qualified people, very intelligent guys, and as I said, it's a privilege. My typical patients vary all over.
Because you're in Santa Barbara and UCLA?
I'm in Santa Barbara, and I have a private practice at UCLA as well. So they vary all over the map. We do a lot of women from 30s to 60s and 70 age group. We do men, we do hair transplants. So we do a lot of different things, all related though to the face. So in that sense, I'm a one-trick pony. Okay,
so you just do the face. Now, one of the reasons why, when we got together and we were saying, okay, for the new show, the Wellness Hour Live, for people that don't know about the Wellness Hour Live, real interviews, we call it news that makes you healthier. But we want to present, with real doctors, great credentials, to kind of, help the public know, because this is one of those things that buyers have to beware, that not all stem cell treatments, I guess, are the same, and some are called stem cell treatments, and they're not. So let's begin though with, for the face, under the eyes, or making the skin look younger. Okay.
Yeah. Well,
what's out there? I mean, what's available?
Well, there's a lot out there, and it starts with creams, stem cell creams, and these are often creams that take different stem cells, plant stem cells, animal stem cells, and some take different types of human stem cells and encapsulate them so that the growth factors can try and restore and rejuvenate the skin.
Do they work?
Some of them do. There are two that I like, and I don't want to use names here.
You might as well. What's one that you like? Give me one you like.
Well, I personally use Lifeline Skincare's product.
Lifeline, I've seen their stuff.
Yeah, and that's good for sun-damaged skin. There are a couple types of creams that stimulate stem cells. There's a fibroblast growth factor. Because remember, basically, that the skin goes through a cycle that it does. It goes, first of all, the stem cell can form another stem cell, or it can form a corneocyte, which is sort of a progenitor cell for the cells of the skin. Okay. And we want it to go that way. We want it to rebuild the skin and go through a progression.
But can these topicals do that?
Some of them can, yes.
Interesting.
Yeah, some of them can. Again, we're not doing a facelift with them, but to rejuvenate the skin and make it look better, absolutely.
Your wife uses these topical products?
I think everybody's wife uses these topical products.
No, but I mean these stem cell products? I mean, obviously you're going to expose her to the best stuff that's out there.
Yeah, I mean,
okay.
There are different types of topical stimulations that can be done, and those go through pathways that are pretty well defined, and there are a variety of those. There's the WNT pathway, there's a sonic hedgehog. I mean, there's a million of these pathways to stimulate.
But are these human? The ones you like are from human
the
stem
growth
cells?
factors are, yeah.
Okay, and it's legal here?
It's legal here, yeah. It's FDA. Well, it's a cosmeceutical.
So is that what you look for? So if somebody's out there saying, okay, I want to look for a skin topical cream that has stem cells, you have to look for human growth. I mean, what's on there? Like, what do we look for?
Well, there are arguments either way.
But what should they look for, in your opinion?
I think that they should look for a cream that works for them, basically. This is the only one I found that really reverses sun damage, and so I like it. Okay. But there are many others that help to rejuvenate and make the skin moister and better looking and so forth. And that's a trial and error, and should talk to your dermatologist or facial plastic surgeon. Yeah.
So under the eyes, there's a lot of injecting things like PRP, platelet-rich plasma, also your own fat, putting into your face, or stem cells apparently in there. So what's what's the best, or what works, or what's your experience there?
Well, I think a lot of that is in the hands of the user and depends on the patient. Should you lift? Should you inject? Should you fill? There are a lot of fillers out there, but let's talk about stem cells because that's what we're talking about today. Fat does contain some stem cells, and it's always, and we've been doing it since 1982, been noticed to make the skin better in addition to filling it out. There's no evidence that concentrating those stem cells helps any more than just the fat. Matter of fact, there's evidence to the contrary that they're probably, about equal. The only problem with injecting fat is there are very, very, very rare incidents of blindness and strokes and things from the fat getting into some of the vessels in the
By putting it under the eyes?
Yeah.
Okay.
Yeah. Now, my own preference is platelet-rich plasma, which you know, and I like it because it's safe. What platelet-rich plasma does is it contains growth factors that can go ahead and stimulate the skin, and that works pretty well also.
I mean, you like it a lot, though. Because I called you, I remember, because somebody in San Diego was going to do some PRP. It's I guess they draw your blood, they spin it, add something to it, whatever, and then it's injected in your face. And I called you, and you said, Randy, and I'm going to quote you, you said, in some cases, it's working better than fillers.
Yeah, I really think so. It's very
like
even.
Where it's filling in, though, a pocket?
Yeah, it evens things out.
Like
sometimes.
Your own body is producing more collagen?
That's true. It does that. It produces more collagen. It stimulates some of the fat cells in there. It provides a mesh network that the stem cells grow into, not only of the face, but of the hair also. And one of the things that we're using it is with different scaffolds, which are networks to regrow hair, actually. And the Hair Society is doing that. Yeah.
So PRP, that's your biggest bet. And there are some stem cells in there, or it works with your own stem cells?
It makes a mesh that your own stem cells grow into.
Okay.
And that causes the skin to regenerate. That stimulation and the growth factors that those stem cells secrete are what cause your skin to regenerate.
Okay. And what's the biggest misconception, by the way, because we have 1 minute left, about stem cells that you want people to know?
That you can do a stem cell facelift and it's any different than fat injection.
Okay. Elaborate.
Well, basically, all fat contains stem cells. So if you have a fat injection, the question is, does concentrating the stem cells within the fat do you any good? So far, the evidence is no.
Okay.
So far, the evidence is no on evidence-based papers and things like that. Now, some people have different concepts of that and believe it does, and I'm not going to fight with them, but we don't yet have the evidence that it makes any difference whatsoever.
You've tried it? Have you tried it?
I have not, but I've been around people who have.
And they say it doesn't work.
Most of them say it doesn't make any difference, and that's the published reports with the statistics.
Okay, so you're saying then PRP?
Well, PRP is safe. You don't have you can inject
but
it right
into
the vessel. Yes.
Okay.
Yes.
So under the eyes, and I don't want to pretend to know exactly about this. I mean, most of what I know here is listening to you, right? But you could inject fillers here, or you can put PRP in combination with fillers.
You can.
Is that ideal?
I think so. And a lot of people who like fillers use the PRP only for the area under the eye, the tear trough area where looks like a tear trough as it comes down as we age.
Mm-hmm. Okay. So good. So if somebody wants to find out more about you, they go to drkeller.com. You have a full facility with minimally invasive.
It's actually gregorykeller.com.
drgregorykeller.com.
Or rejuvelase.com.
Okay. And you do facelifting and all the minimally invasive, non-invasive stuff.
We do.
Okay, good. And you're going to Botox to me after the show. All right. Okay. Thank you for coming to the show. Very interesting.
My pleasure, Randy.
I'm Randy Alvarez. We'll be right back.